Hi guys! So recently I was in a gathering of about 10 persons, including myself, and each person were required to talk about a topic they were passionate about. It could be health, politics, love, relationship, and of course I chose health because what more can I talk about if not health? Well, it got to my turn and I was at the crossroads picking a topic to talk about. So I decided to ask questions. My first question was asking how many people knew their BP and how recent they checked. Now, 8 out of 9 persons were like they checked their blood pressure recently, and 6 out of those 9 persons actually showed me evidence, right? Now I went on to ask, how long ago did you check your HIV status, and do you know your HIV status? Now 6 out of the 9 persons said they usually check their HIV status month on month and they knew their HIV status. So I went on further to ask, how many of you know your hepatitis B status and how long ago did you check? Now this was where it got interesting because 5 out of the 9 persons said they actually know their hepatitis B status, while 3 out of those 5 persons said they recently checked their hepatitis B status. And guys, we had a winner. I had to talk about hepatitis B. I went further to ask what they knew about HIV as compared to hepatitis B. Many people had a lot to say about HIV as compared to hepatitis B. Now in this video, I'm going to give you 5 reasons why hepatitis B is worse than HIV. You want to save this video for later. 1. Let's talk about the transmission rate. The risk of transmission for HIV is less than 1% when it comes to needle stick injury with contaminated blood as compared to hepatitis B virus, which is 6 to 30% transmission rate depending on the concentration of the virus in the blood. What this means is that for every time you are pricked by a needle that is contaminated with either HIV or hepatitis B virus, you have a higher chance of contracting hepatitis B virus as compared to HIV. 2. Let's talk about the survival rate of both viruses outside the body. HIV cannot survive outside the human body for long. It needs a human host to reproduce. So when it comes in contact with the outside environment, it becomes inactive. Hepatitis B virus, on the other hand, can survive up to 7 days outside the human body, thereby increasing the risk of transmission through indirect contact. 3. Modes of transmission. While HIV and hepatitis B virus share primary modes of transmission such as your sexual contact, mother to child, blood transfusion, and sharing infected needles, hepatitis B virus can also be transmitted through indirect contact. Remember I said that hepatitis B virus can survive up to 7 days outside the human body. What this means is you can also contract hepatitis B virus from sharing your personal items such as your nail clipper, your razor, and even your toothbrush. Hepatitis B virus can also be contracted through household contact, such as your countertops, doorknobs, and even our shared gym equipment. 4. Organ-related complications. Now, hepatitis B virus is known to primarily affect the liver, and chronic infection can lead to serious liver disease. Do you know that liver cancer caused by hepatitis B virus is one of the leading causes of cancer deaths worldwide? HIV, on the other hand, is known to compromise the immune system, but it does not directly cause such specific and severe organ damage the way hepatitis B virus does. 5. Treatment options. While there is still no cure for HIV, the antiretroviral therapy has been known to effectively control the virus, reduce the viral load to undetectable levels in the blood, and prevent the progression of HIV to AIDS. With this antiretroviral therapy, people living with HIV can live long and healthy lives with consistent treatment. Hepatitis B virus, on the other hand, do not have a complete cure yet, but there are antiviral treatments that can be used to suppress the virus and reduce the risk of liver disease. The downside to this is these drugs usually need to be taken for life, and the virus can still be present in the liver. Also, antiviral treatments for HIV are readily available and accessible compared to that of hepatitis B virus. The good news is hepatitis B virus has something that HIV doesn't have, which is the availability of the hepatitis B virus vaccine. Yes, the hepatitis B virus vaccine is your sure bet in protecting yourself and ensuring that you do not contract this virus. Walk into any health facility today to get tested for the virus and get vaccinated. Ladies and gents, I hope I've been able to convince and not confuse you why you should be wary of the hepatitis B virus the same way you are of HIV. Guys, remember to always protect yourself, and vaccination is the key. Don't forget to like, comment, share, and follow for more health tips. You are welcome.